Okay, good morning, everyone. We're going to get started. I think it's the top of the hour. Thank you for joining us today to talk about this crucial topic, clearly affecting not only post-secondary ed, what we're talking about today, but K-12, and obviously beyond the higher education experience as well. My name is Jill Buban. I am the GM for EdAssist by Bright Horizons. We're a workforce education company. Been coming to this event for many years, thrilled to be moderating this panel. And, I think prior to EdAssist, I did a lot of research around how mental health services can help not only traditional age learners, but non-traditional age learners in online environments, graduate students. So it is a topic near and dear to my heart, although it doesn't sound like it's connected to workforce education. I think it's important to say that all learners, no matter their age, traditional, non-traditional, are seeking resources and how we can support every learner. So I'm joined here on stage by some new friends that we met and brought us together due to ASU+GSV. Michael London from UWill, Lori Evans from Caraway. She's going to talk a little bit about that, very excited. Ed Gaussen of Mantra Health, OB Felten from Flourish Labs, and Marissa is here with us from OMERS Ventures. So we're going to have a robust discussion, hopefully, around some great topics today. I'm going to let each of the panelists introduce themselves now, starting with Michael.
Hi, everybody. For those of you who I have not had the opportunity to meet, my name is Michael London, and I'm the founder and CEO of UWill. I've been a social impact serial entrepreneur for a while now. I've started a number of different companies in the space, and I would say that, in terms of social impact, not all groups are created equally, and this is the most pressing and important issue that I've ever tackled, and I'm super excited to be part of the panel, and I appreciate you all for coming. Thanks.
Hi, everybody. I'm Lori. I'm co-founder and CEO of Caraway, a women's health company built for college students. Also a serial entrepreneur. This is my third healthcare company, and my first one that is aligned and focused on education. So it's my first time coming here, first time meeting all of you, which is really wonderful. And I was told that working with universities would actually be easier and take less time than working with health systems and health plans. What do you think?
Good luck.
Yeah, it's a great segue to Mantra Health. So my first time as well at the conference. It's nice to meet you all. Thanks for coming. We're a digital mental health clinic focused on the treatment of young adults. So we think about the patients that we serve as the 40 million young adults today that suffer from mental health issues. When we think about how to tackle that, we look at, obviously, partnerships with universities, which is probably our core focus right now, but we also work with health plans and payers. So glad to be here, glad to touch on this subject that's so important. Again, thanks for coming.
Hi, everyone. My name is Marissa Schleder, another first-timer at the conference. I'm excited to be here. I'm a health tech investor at OMERS Ventures, where we'll invest anywhere from Series A to Series C. We invest across a lot of different spaces, but my core area is health tech. My entire career has been in finance, one way, shape, or form. The last few years I was at CB Insights and led a lot of our digital health research there, specifically telehealth and medical devices. But I also have personal experience here. I have OCD. I struggled with it a lot when I was in college, and the student, health facilities were not very helpful for me, and I wasn't diagnosed until I actually saw someone at an on-site clinic on Wall Street when I moved to New York. So, of all places, right? But yeah, personal experience and personal interest, and our fund, looking at health tech broadly, we see a lot of opportunity in Gen Z and college-age students in general. So I'm sure we'll get into some of that. Excited to talk to all of you.
So I'm OB Felten. I'm the founder and CEO of Flourish Labs. So we are very focused on increasing the supply side. So we don't have enough therapists today to serve everybody. Only about a third of people actually get any therapy who have a diagnosis. And with students, it's even worse. So we are training people to become peer support specialists to then serve them and provide access to someone who gets you because they've been in your shoes. So a peer supporter is someone who's had mental health issues in their past themselves and is in recovery. And we think there's a great opportunity to scale that workforce. It's tiny today, and solve the student mental health problem by providing student jobs so that people can try out this profession. And then some might go on to become a psychiatrist or a therapist, and for some this might actually be the role that they do for the rest of their life. We also have a measurement solution for students so that they can track the ups and downs of their own mental health, because it's actually incredibly difficult to self-assess. Like, your story, Marissa, is very common, that people don't know whether what they're experiencing is just a little bit of stress or whether they're actually in distress and should be seeking professional help. And my background is in technology. I left Google after 15 years to start this company last year.
That's great. Thanks, everyone. So let's get started with a few questions. I hate to put you on the spot again, Michael, but we'll start with you again.
I'm in.
So I know that before starting UWill, you did extensive research and met with many college presidents to try to understand the landscape a little better. How did that help you shape your offering and shape how you thought about therapy on campuses?
Truth be told, there were a few things that did prompt me to start New UWill. Had, like a lot of people here, I had a personal experience within the family. Father passed away when I was younger. I was the mental health advocate for my younger brother since the time I was about 20 and he was 15, and I still hold that important position today. Don't do very well at it a lot of the time, by the way, because it's hard. And you learn that the system is not perfect, and that was one factor. To your question, for me, I was fortunate enough to have been, had a large number of higher ed customers in a past company that I founded. It was called Examity. And I was able to do primary research that I think, gave me a unique perspective on what was truly happening on the campus. And I will tell you anecdotally that a lot of times when I talk to, esteemed college presidents, they would say to me, look, one of our biggest issues is mental health. And by the way, this is way before the pandemic. And then they would whisper, and I have no idea what to do about it. Mm-hmm. And so when people say something so powerfully, it drives you. It makes you realize that you're doing something that could really matter. And so those factors in particular, and some of the work that I'd done in volunteerism at Beth Israel Hospital in Boston, just helped me to put it all together and start UWill.
That's great, Michael. And I understand that a part of your software as a service, I guess you would say, right, has a matching capability for students. Why is that important? Why does it matter?
I think it matters because even though it's really hard, to your point, Obi, it's hard because there aren't that many therapists out there. But generally, people will do best with a therapist who makes them feel right. So if they can match on a number of factors to an individual, so whether it's gender or ethnicity or specialty area, whether it's time. So what if they want to see someone the same day? What if they want to see someone in 3 days? If a person has the ability, a student in particular, to match on factors like those, they have a high likelihood of having a better experience, which can lead to a better outcome. Certainly, immediacy leads to happiness based upon pretty much every single study that exists. So to put that all together, I think is particularly relevant.
Can I add to that? So there's actually studies on this, and it's about 50 to 70% of the effectiveness of therapy is based on what's called the Therapeutic Alliance, so how the quality of the match. And that's astonishing, right? So like whatever the therapist practices, whether it's psychoanalysis or CBT, is less important than whether you can relate well to the therapist. And that's particularly important now because we're in this supply-constrained environment. So if you are a Black first-generation student with OCD, good luck finding a therapist that looks like you, right? Because that's just very difficult. Like you're kind of struggling to find a therapist in the first place, let alone someone that you can relate to on those other dimensions that Michael mentioned, which are really important in terms of building the trust and the affinity.
And then on top of that, trying to find a provider in your plans network.
Yeah, exactly, who takes your insurance.
So that's an interesting point because with both, I believe, with both Mantra and UWill, I mean, that takes the health insurance equation out of the picture, right? So I don't, can you talk a little bit about that model and how maybe it's more accessible for students?
To be able to support health insurance billing? Or what's the question?
So you work with universities, correct? And so how does that model, that payment model work?
Yeah, absolutely. So, we again think about the problem as, of course, universities are struggling to tackle this issue. A lot of students that struggle from mental health problems today don't actually access care through what the university gives them.
Right.
So if you think about the mission of tackling the young adult mental health crisis, there's a lot of issues that just go beyond what's happening on college campuses. One of them, for example, that we're thinking about is what happens when a student graduates. Yeah. So, let's say a student goes to the counseling center, they've been receiving, free mental health care for 4 years, great. What happens after you graduate? What do you do at that point? You might be on your parents' insurance plan, you might be staying in the state, you might be going to another state, but there's no warm handoff. Right. To a provider that will work for you. And so we've thought about this problem very, very clearly and trying to think about how do we tackle the young adult mental health crisis at the core of the vision, and everything that we do is kind of working backwards from there. Obviously, universities are a big payer when it comes to trying to support their needs of young adults, but it's such an interesting population because you also have to think about, how does health insurance come in? How do parents come in at some point as well? So we're doing a lot in our product roadmap to think about that. As far as what we're doing today in our model, basically the school will sponsor a limit of sessions, after which the students will seamlessly transition into being able to self-pay, and assuming we're in network with their insurance company, they're able to then work with that same provider. Even long after they graduate, and we're seeing this from our early cohorts of students graduating. So it's really exciting to see. It solves a huge need for colleges and universities, but more importantly, it solves kind of the issue at hand, which is larger than just what's specifically happening on college campuses.
That's phenomenal. The continuation of care, right? Because oftentimes, I think I've thought about what happens during the summer months and how the virtual therapy can help because you can still go ahead. Yeah.
Yeah, and the other thing about that as well is that we've all in this room, I think, have some level of appreciation for what's happening with decreasing enrollments in higher education, the sort of constraints that are going on the budget side of things. And so you have to think about how do we actually help schools help their students and not just put the pressure on them to say, hey, this is the solution, figure it out, making work within your budget. So being able to offer that flexibility, I think, is mission critical, I think, in terms of how we look at it.
Yeah.
And the budgets are much bigger. So when you look at the spend for our counseling centers is about $2 billion a year across the US, which is actually a really small number if you think about it. And the insurance reimbursement for that age group is $17 billion. So people are already mostly getting their care through either self-pay or through insurance. The number served by the counseling centers themselves is not that big.
Yeah, and another data point that I think speaks to this as well when we're doing our early research into building Mantra is that actually 80% of students who attempt suicide every year actually never make it to the counseling center.
Yeah, that's right.
And so obviously hopefully that number is shifting in the right direction. We're in our philosophy believe that university counseling centers are a critical part of providing the care. They're a piece of the puzzle. And they're doing a great job at breaking the stigma on campuses.
Yeah.
They're also really overwhelmed and have long wait lists, right?
Exactly, and have long wait lists, and yet some of the highest acuity patients sometimes are hiding in the darkness.
Yep.
And we need to think about the fact that the second leading cause of death with this population is suicide. Yeah. And how do we treat these higher acuity patients as well?
Yeah, so kind of I'm trying to pull this all together because I'm curious. I don't know everyone's level of knowledge in the audience. I was shocked a couple years ago when visiting a very large Research One institution in the country and hearing about how like basically the suicide crisis, but also tying it to therapy on campus. And the issue is you have a therapist on campus and you go home, you know, from Michigan, that's not where the school was, but from Michigan to New Jersey, and your therapist in Michigan is not licensed in every other state. So then there is no continuity of care. Or you're a new freshman on campus, and to the point that you already had your parents' health care, I'm thinking of the $17 billion, you know, number, and you were in New Jersey and now you're in Michigan and your New Jersey therapist cannot help you. So I don't know, Michael, if you can speak a little bit to the kind of state-by-state regulations and why the virtual is a good solution.
State regulations, yuck. Just joking. No, I think it is critical. I mean, you know, and probably Ed would say the same thing. You know, one of the barriers to entry in doing teletherapy for colleges is that you truly need a state-by-state network, because a therapist, even in teletherapy, needs to be licensed in the state in which they are delivering their care. That said, you know, you have to go state by state. So how do you really do that, right? So one way is you look at each state as an individual center. You build out a counseling group in that state. You make sure there's proper diversity, as I had mentioned earlier on, within that state. And then you really have to work hard to further engage those therapists, because you can't afford not to have them, because the stuff that we're talking about is especially serious. And so for us, you know, that's something we did in the front end. We thought it was of particular importance. You know, we wanted to be in all 50 states right away, because, again, recognizing how schools work, they have people in all 50 states. And so there is that need. So if you think that you're, as an example, you know, of course, if we're working with, University of Maryland, we're going to have more people who are in Maryland, both because they're on the campus and because more people actually reside in Maryland. On the other hand, you can't just think that's going to work. And so for us, that was a big undertaking, and it's an ongoing endeavor as part of the organization.
Can I just add to that quickly?
Absolutely.
Yeah, it's not just about having coverage in the off chance that someone needs to have a scheduled session when they're away from campus. If you think about the types of stressors that college kids undergo when they're going home for Christmas break or spring break or whatever it is, there's a lot of unique stressors that are associated around those experiences, right? Seeing all your friends from high school and what they're up to, and what their college experience is like, and having conversations with your parents about what your internship progress is you know.
Whether you're out or not.
Coming to a 5,000 person campus after being in COVID for 2 years. I don't know about you guys.
Yeah, those I actually would argue, I mean, from my personal experience too, those were the times that I really needed to talk to someone.
Yeah.
You know, the maintenance, there's a lot of maintenance that can happen when you are on campus, but with people that know your routine, but a lot gets shaken up when you head home for those breaks.
Yeah, and I'll add, because we spent a lot of time thinking about this as well. When the pandemic hit, there was actually a clawback of the state-by-state constraints, and so counseling centers, you know, were trying to think about, well, should we practice across states? Are these going to be clawed back?
Absolutely.
And it was a very, very interesting moment where that's kind of when you had to think about, okay, well, are we going to be that company that's just going to say, okay, well, we're just going to try and practice across all 50 states and hope for the best that, you know, it doesn't come back, or are these going to be clawed back? And it turns out that they are. And, you know, we took the same approach of saying, nope, we've got to have providers licensed in all 50 states, and that's what we're going to do. And actually, President Biden, in his State of the Union address in early March, actually talked about this and talked about how the administration was going to work towards removing these barriers, which is really exciting, specifically in the context of telebehavioral health. So we'll be paying attention to that. You know, not a lot of details, unfortunately, but you know, at least the intention is there. There's a lot of bills at the Congress level that are being talked about. And the other thing I was going to talk about as well when it comes to state-by-state licensure is that therapy is one thing, where actually, you know, historically there's been a sort of level playing field across the country when it comes to thinking about it. When it comes to psychiatry, it is a lot more difficult because certain states we'll have different laws around prescribing medication over telehealth. And then you've got non-scheduled medications, you've got scheduled medications. You have to think about, are you using a psychiatrist or a psychiatric nurse practitioner? If it's a psychiatric nurse practitioner, they have to be supervised in about half the states in the country. So yeah, still a lot of headaches to work through. Yuck, as Michael said, but you know, hopefully we'll get there.
This is, as a European, this is such a bizarre setup. Germany is also a federal state system, but like you can practice across the nation. And it applies even to peer support specialists. So the codes and the qualification level is set by CMS at a state-by-state level. And in the same State of the Union address, they also said, we want a national certification for peer supporters. Personally, I'm not holding my breath. We're assuming that we have to do it state by state. But I think allowing the qualification of the same person to go across states, to me, is the better model when you look at it from the user's point of view. So the student doesn't want to be handed off to someone who's licensed in Maryland. They want their own therapist to then be also licensed in Maryland. So getting the same provider certified in multiple states is what we're focusing on.
And Obi, going back to something Marissa said and those stressors in going home, I think that's real for a lot of students, or going home or starting a new job, whatever, when you're out of the norm, coming to the conference, whatever it is. Could you tell us a little how the self-tracking, how you got to that self-tracking app, and how I would assume that's something could actually help in those situations?
Yeah, absolutely. So first of all, there's the reason why 70% of mental health problems show up under the age of 24 is because you go through these really important transitions from middle school to high school, from high school to college, and serious mental illness like schizophrenia and SMI and bipolar often shows up around that kind of first year in college, which makes it especially difficult. So my personal experience when I first got interested in mental health was actually a personal story where my boyfriend, when we were 29, was diagnosed with bipolar. And we'd been together since college, and he had actually been cycling for 10 years, and we had no idea. And I was working in e-commerce at the time where everything was measurable, and I didn't understand, like, how is it that we have no good measurement in mental health? And fast forward 20 years later, we still don't have good measurement in mental health. We have surveys like PHQ-9, which ask people questions that are very difficult for them to answer, like how on average has your mood been better or worse in the last 14 days than the 14 days before? I mean, that's not how human memory works. And so I first got interested in this sort of question of measurement back then. And so the app we've built is grounded in all the science around measurement, and it takes two input streams. So one is we push a daily survey. We call it a check-in. So it prompts the student to self-reflect in the moment. Because if you're asking someone, like, what is your mood like right now, they can answer that question fairly accurately. And then we plot the chart for them of how their mood has changed over the last few weeks or months. And then the second piece we take in is if the student has a wearable, like a Fitbit or an Apple Watch or an Oura Ring, which is what I wear, they can connect it and they can see their sleep data. Because sleep is probably the single most important factor in mental health, and it's impossible to self-assess. Like if you ask someone how they slept, like in sleep studies, they've demonstrated over and over again that people can't do that. And so it's not a diagnostic tool, it's not a medical tool, it's a tool for the student to create that self-awareness. And so that you can see, hey, actually my mood's been going down, so maybe I should be doing some self-care, like meditation before bedtime, or actually maybe I should be reaching out for some help. So that was sort of the starting point for us. But then we very quickly realized, of course, that's not enough, like the measurement's not enough, like how do we then get them support? Right? Mm-hmm. And so our beta app right now is measurement plus crisis support. So we integrate a crisis text line. You hit one button, you're texting with a crisis counselor, and then this summer we'll be launching the peer support product that we've been designing with students for the last few months.
That's great. Thanks, Obi. I'm curious, we haven't said the elephant in the room, the stigma around mental health, right? And I think that is shifting, and great, due to some of the work by great people on this panel. But I also, Lori, I'm thinking of you and your new company that's focused on young women. And, there's also a certain stigma for women who have female-related health issues and asking asking for help. So, and by the way, you guys are very lucky because Lori just announced the name of her company, so you're the first to know. It's very exciting. But I'm curious if you can talk a little bit about that and how Caraway can help maybe break down those barriers or how you envision it working.
Yeah, no, I appreciate that, and it's just wonderful to be learning from all of you up here, and hopefully all the regulatory issues will be settled by the time we get our act together. Thanks to you guys. But we're focusing on women's health for many reasons. One is in the U.S., women's health outcomes are getting worse, not better. There are shattering disparities among women across socioeconomic, racial, educational areas. Reproductive health is being very politicized. Women's needs are underdiagnosed, undertreated, underrepresented across all ages. Most women only enter the U.S. healthcare system when they're having a baby.
That's unbelievable.
And in thinking about college-age women, you're all experiencing this. Shortage of providers, inadequate care options, underwhelming quality. It just goes on and on and on and on, and you're all grappling with this. And we want to help provide with all of you a comprehensive approach to care and integrate women's health with mental health and with social determinants of health. And not all mental health is straight mental health, right? Rising rates of obesity impact mood, impact mental health. And so our view is that as we're all rushing to create access, we have to make sure that we're not forgetting about quality. And with young women especially receiving care in this incredibly special developmental period, whether it's a diagnosis, a medication, an interaction, will have a profound effect on their lifetime outcomes. I mean, profound effect over the long term. And it'll impact how they view their own health. It'll impact how they engage and trust in the healthcare system. So all of our solutions have to incorporate that fact.
Yeah.
And in all of our decision-making, in all of our approaches. And that's what we're going to try to do at Caraway.
I love it. And I also think of, I could probably talk with you about this for hours, but I think of how, historically and continuing to be, women just have this well, you just have to get through it. I have to get through the day. I have to take care of my kids. I have to get to work. And I think that's more, sorry if it sounds stereotypical, but more so than males. So being able to think about care through that lens and saying it's okay to care about yourself as a female is really phenomenal. And to start at that young age, because as you said, it is very formative.
And Obi, you really said it. I mean, the amount of diagnosis that happens, between 17 and 25 really it's such a critical developmental stage, and our solutions have to accommodate and have to recognize and factor in those developmental stages.
Yeah.
I'll tell you one anecdote. So one of the first doctors I interviewed 5 years ago when I started working on this idea was a primary care doc in a health clinic at a university. And I said, what percentage of your caseload is mental health? And she said, well, everything is either STD or mental health. So if you can cover both.
Yeah.
That's
and
scary.
a lot of times you can identify where there might be a mental health crisis from someone that's presenting frequently for sexually related indications.
Interesting. So I'm glad you said something, Marissa. I was just going to ask you. So you can't help but notice how many investors are here, and obviously it's ASU and GSV and what's happening. And so I'm curious if you can talk a little bit about this market. It just seems to be booming. The mental health market, women's health, whatever it may be, but healthcare for post-secondary ed, and kind of what you're seeing.
Yeah, I mean, I think we're looking at healthcare broadly, right?
Yep.
Mental health is one segment of that. Obviously, that's been booming. I think the first wave of it was really focused on getting to otherwise well individuals, maybe through their employers, through benefits programs, EAP programs, et cetera. And not a ton of focus was given to people of this Gen Z, right, or this 18 to 25 age bucket, because they're considered otherwise well. What we found over the course of the pandemic is that that's not true. There's been a lot more attention put on from the university's perspective as well on solving this crisis. And so I'm thinking, we're seeing more and more companies pop up or move into this space, which is good. There should be more activity and focus on this population. But I think it's not just about solving. What gets us excited is that it's not just about solving their problems when they're on campus. It's really the longitudinal care journey, and we've talked about this already at length, so I'm not going to belabor it. But I think one thing we haven't touched on is just how unique Gen Z is as a generation, and how they interact with technology in a way that's different than other generations. Millennials were lucky to maybe get a smartphone in high school, right? These Gen Z grew up with smartphones, and they expect different relationships with their healthcare providers. And the other thing is, when they're entering college, they're moving away from a pediatrician, maybe that their mother or their father kind of was ushering them towards. And so they're beginning to make these decisions on who they want to interact with for the rest of their adult lives. So I think, from an investor standpoint, that's tremendous opportunity, right? If you can engage with a young individual at this formative stage in not only their health development, but also just their adult development, and how they think about the world and how they think about their own healthcare, can be a tremendous market opportunity as they age. And I think it makes sense if we're talking about telehealth and other digital tools, assessments, et cetera, catering to this specific population.
Absolutely.
Yeah, I completely agree. And like Ed was talking about, we also see this as, you might encounter a product as a student, but we want to be able to stay with people. So we're not selling to universities. It'll be reimbursed through health plans, partly because of that reason. The designing with Gen Z students has been really, really interesting. So the way they think about mental health care is very different. So they're actually not super excited about the traditional model that Freud invented in the 1890s, where you see someone for an hour a week sitting on a couch somewhere, right? They want more frequent access, they want touch points in between, and we're even going to a model where we'll connect them with more than one provider, which sounds like completely heretical, but it's how they think, right? So in our last design workshop, one of the students said, so it's like Bumble for therapy, where they're dating multiple people, and so to them it's very natural that they might go to one person to talk about their transgender stuff and another person about their OCD. And what that gives us is some redundancy, so you have more than one person to go to, and you can see yourself reflected in the group, but we don't have to find you one person who has, all those different characteristics. And I don't think that would have happened with millennials. It's a very Gen Z thing, and you can only do that through technology and the fact that they're so totally used to having their care delivered now on.
I would say too, where they're looking for health guidance and information. I mean, it's astonishing how many of them go to TikTok, and they might not have personal relationships with some of these influencers, but they feel like they do, and sometimes that's all that they need.
And Insta, it's TikTok and Insta.
So,
whereas we all search on Google, right, for health information.
So Marissa, I think you kind of started us off on what the future would look like as well. So I'm curious for a couple of last minute thoughts on we've, I think, come very far over the past few years, whether that was urged on by COVID or not, but it seems like great strides in terms of different facets of healthcare, specifically, mental health for students. I don't know. What do you think, Michael? What's the future? How is it going to continue to evolve?
Well, if students are on a campus in particular, I think that even though there's a lot of truth to what's being said around the utilization of the campus counseling center, I think that's here to stay, and I think it's really important. I think we certainly have a need for campuses, traditional campuses, to have people on staff and to be able to help people who do want to come in. On the other hand, there's a lot more looking outside at private partnerships, and in those instances, you are going to see more groups like what we're all talking about who are working hard to complement the good work that's being done on a campus. And the mutual respect, the integration of the technology, and the ability to truly help students, I think, will bind us together, and that's the way the campus future will look. I think, in addition, when you think about the less traditional campus, you certainly need to have an online offering that's every bit as good as what would be on a traditional campus. And that's helpful both in the online world and also for students who are on a campus, because they also like to do things online, as that's also been said. So that's the way it's going. There's a huge trend here. I think I mentioned this to you guys. Like, we got our 100th client, right? And we've only been around 2 years. So you're talking about something that is very important. People are interested in it, and people are really more open than ever to partnering outside the school.
Ed, Lori, anything to add to that? What's the future? Crystal ball moment.
Yeah, I mean, I'm happy to speak to it. I would say on our end, the future is it has to do with obviously how you think about complementing counseling centers, on-campus staff. For sure, we're seeing the need for that, and it's going to continue. I think that a lot of the time we speak a lot about the treatment and enough the cure. And what is the cure for the young adult mental health crisis in the future?
Right.
This is where I think we also need to talk a lot more about prevention. So holistic care, thinking about products that are more tailored to the subclinical population. I really do think that this is where we're falling short. There's a popular story called the RAND study that came out in 2018 that talks about the return on investment of therapy dollars invested by the school to the amount of retained students, and therefore tuition dollars for those students that didn't drop out. What's not in that study is, well, wait a minute, it's just money in, money out, assuming that every single amount of dollars invested in mental health care is equal. And there's no thought in there about how do we ultimately create a more holistic offering that's much more end-to-end to really think about, well, how do we actually keep students away from getting to the point where they do need clinical care?
Right.
And when students get to clinical care, how do we put, and then when students get to clinical care, how do we make sure that it experiences as good as possible? This is a lot of what we talked about today. We didn't talk a lot about prevention.
Yeah.
So this is a lot of what a lot of the work that we're doing now as a company is sort of trying to think about that in the future. And I really think that this is actually what will move the needle for college campuses in the future.
And I see that so many similarities when listening to Lori, like the prevention is key. So.
Yeah, no, it is. And I think that we, as a healthcare person until now, where it's sort of more, we have to bring agency and empowerment to this generation of not just women, right? Men too, to demand a different experience from the healthcare system. Absolutely. And to think about health as a lifelong journey, not something you do when you get sick only, or not something you do when you have a baby only. And I think that we all have this amazing opportunity to do that.
Yeah, absolutely. So I know we're running out of time. We have just over...
Can I just add one more thing to that?
Sure.
So I mean, our vision is flourishing minds for all. So it's not about just getting people better who are already sick. It's about keeping people healthy. And I think it's about actually empowering people to help each other more. And that's why there's a lot of informal peer support that's happening already. If we can train those peer supporters to become professional at it so that they keep themselves safe and the person that they're helping safe, that's a much more scalable model. And ultimately, you change that power dynamic, right? So it's no longer like a therapist who sort of talks down at a student, but it's actually students learning from each other. And it's what's amazing in that model is you get an uplift on both sides. So people stay healthy, both as the person giving the support as well as the person receiving the support.
I wish we had another session because I do think that's interesting, but as a lifelong educator, it does get me a little nervous because it's, a therapist does have a degree in therapy where you're then like the peer-to-peer is like, what are they doing with each other?
Look at the studies, the outcomes are really solid.
Yeah.
It will surprise you. I can send you the studies.
So I want to thank all the panelists. I'm sure they'll be here for a couple minutes. We didn't get to leave time for questions, but thank you all so much for taking the time to join us and definitely opening my eyes. And thank you all so much for coming and listening. I hope it was fruitful and that started your day off right. Thank you.
Yeah.